Look, in the pharmaceutical industry, let's be honest, the stakes couldn't possibly be higher. A single oversight can literally lead to disastrous consequences. That means compliance, quality, and efficacy, they're absolutely non-negotiable. But you might be wondering, how do you actually ensure perfection in an environment that has endless variables? Well, today in this explainer, we're diving into a really transformative lean management technique that answers that exact question, the Gemba Walk. We're going to explore what it is, why it's so critical, and exactly how you can implement it in your own facility.
If you're relying entirely on lagging indicators, things like reports, regulatory actions, or worse, product recalls, you're already way too late. In pharma, errors and non-compliance don't just hurt the bottom line, they present real, tangible harm to patients. The industry absolutely demands a proactive solution. We need a way to catch and correct an issue long before it snowballs into a massive non-compliance event. And that is exactly where our topic today comes in. It's a strategy borrowed straight from lean management that gets leadership out of the office and directly into the heart of the action to prevent problems before they even happen.
Okay, let's dive into our roadmap for this explainer. First up, the real place. Second, why Gemba matters here. Third, the 7-step implementation. Fourth, key pharmaceutical walk areas. And finally, rules for Gemba success.
All right, Section 1, the real place, understanding the Gemba Walk.
So Gemba, it's a Japanese term that beautifully translates to the real place. And in the context of pharmaceuticals, the real place definitely isn't the boardroom, unless you happen to be manufacturing PowerPoint presentations, right? It's the shop floor. It's exactly where the actual work happens and where value is ultimately added to the product. A Gemba Walk is simply the practice of supervisors, managers, or quality personnel literally leaving their desks and physically stepping onto that production floor. The goal here is to observe the processes directly, engage intimately with the people doing the heavy lifting, and identify risks and potential improvements in real time.
Now, think about traditional audits for a second. They often feel purely compliance-focused and, well, punitive. It's almost like being sent to the principal's office just to check off boxes and find faults. But Gemba Walks, they represent a massive paradigm shift. They're entirely focused on observation and education. You aren't out there to scold anyone. You're there to uncover new opportunities by genuinely understanding the realities of the process from the perspective of the exact people who are executing it day in and day out.
Moving on to Section 2, why Gemba matters here. 4 core benefits.
So why replace those punitive audits with supportive observation? Well, there are 4 core benefits. First, you get real-time insight into operations, because let's face it, so many problems simply aren't visible in a spreadsheet. Direct observation validates whether your standard operating procedures, your SOPs, are actually practical in the real world. Second, it enhances cGMP compliance. You're getting early detection of incomplete documentation or maybe improper hygiene practices long before an inspector ever finds them. Third, it encourages employee involvement. When leadership is actually out on the floor talking to operators, it builds immense trust and motivates them to share vital insights. And finally, it drives continuous improvement. Small, quick notes on workflow inefficiencies lead to those incremental changes that drastically improve safety over time.
Okay, Section 3, the 7-step implementation, moving from theory to the floor. Let's get into the how-to.
All right, let's break down Phase 1, which is all about planning and walking. For Step 1, the absolute key is defining your purpose. We don't just want to wander aimlessly around the facility. Are we focusing on clean room behavior today? Or maybe material handling? Having a distinct focus keeps the walk structured. Step 2 involves creating a checklist. But remember, this is an observation guide to make sure we don't overlook things like proper labeling. It is not a rigid audit. Step 3 is scheduling regular walks. Build a solid calendar with daily short walks, maybe weekly thematic ones, or even monthly cross-functional walks. And Step 4, arguably the most important step of the whole shebang, is to engage with the people. Interaction is literally the whole point here.
Actually, a brilliant open-ended question to ask when you're out there is simply, what challenges are you facing here? You could also try, hey, can you show me what you're doing? Or is there anything you think could be improved? The main objective on the floor is active listening and learning. We don't want to interrupt their workflow, and we absolutely do not correct or blame anyone in the moment. The goal is strictly to gather reality.
Once we've gathered that reality, we enter Phase 2, action and follow-up. Moving right into Step 5, we take notes. You want to document everything respectfully. And hey, make sure to capture the good practices too, not just the SOP deviations. Then, in step 6, we analyze those findings and actually take action. Consolidate what you found, assign responsibilities, and set strict deadlines. And finally, step 7, communicate the outcomes. When an employee's input actually leads to a real change, share those improvements. Celebrate the successes to promote a workplace culture of total openness.
Now, instead of just dumping all those observations into one massive, overwhelming list, we can organize them into satisfying, manageable little buckets. Quick wins are your easy fixes. Maybe it's adding a missing material status tag, or just fixing a flickering light in a specific area. Process improvements go a bit deeper. These might require updating an SOP or conducting a retraining session. And then, systemic issues are your complex problems. These are the ones that will need a formal investigation or a corrective and preventative action plan, also known as CAPA. Organizing your notes this way makes continuous improvement feel incredibly achievable.
Which brings us to Section 4, Key Pharmaceutical Walk Areas, Mapping Your Facility.
Let's ground this methodology in the actual physical space with a quick reference guide. Say you're walking the QC lab. Your focus there should be on checking instrument calibration status, observing analyst practices, and seeing if documentation is happening in real time. Or if you're over in the cleanroom areas, you're looking at HVAC performance and checking those cleaning records. On the packaging line, you'd observe line clearance and operator alertness. In the warehouse, check FIFO, first in, first out compliance. Every single location has its own unique heartbeat and vulnerabilities, so a tailored focus ensures you catch the most critical realities. And finally, Section 5, Rules for Gemba Success, Best Practices. Listen, if you're going to do this, here are the 4 golden rules you have to follow for success. First, be consistent. If your walks are irregular, it sends a really dangerous message that quality only matters sometimes. Second, don't blame. We absolutely must create a no-blame culture where the focus is relentlessly on fixing the process, not punishing the person. Third, and actually I think this is a truly brilliant strategy, go in pairs. Pair quality assurance personnel up with production leaders. This achieves a beautifully balanced observation, blending strict compliance rigor with practical production realities. And lastly, follow-up. Taking action and giving feedback are absolutely mandatory if you want to maintain trust with your team. So Gemba Walks are just a remarkably powerful way to observe reality, engage a team, and ensure regulatory readiness. But here's the catch. They require the exact right intent. When you step onto that shop floor, you really need to ask yourself, are you creating a culture of blame, or are you creating a culture of continuous improvement? Because the choice you make right there will entirely dictate the future of your product's quality. Keep observing, keep improving, and we'll see you in the next Explain.